January was a big month for us and a big advancement in the care that we provide here in Hartsville at Carolina Pines for our community. So share that big news.
We are excited to partner with MUSC Florence cardiologists and offer elective PCI twice a week here at Carolina Pines. If you come with chest pain and do a cardiac cath, we are able to see if you have a narrowed or blocked artery. And now we can put a stent in to open up that blocked artery. Before this program was started, we would have to transfer you to do that. But now we're able to fix it right here without you having to go to another facility.
Welcome to Pulse Check and Happy Heart Month. We're excited to have Ashley Johnson with us today. She is not new to Carolina Pines, but she has a new role as the Director of Cardiovascular Services. So Ashley, I do want you to take a moment and tell us about you. Tell us your journey and what led you here into this new role.
Okay, well, thank you for having me. I'm very excited to be here and talk about our services that we are now offering at Carolina Pines. So, like you said, I've been here for a long time. I got here in 2009. I was an ICU nurse for about 10 years. And then I went to a nursing supervisor, emergency department role. And then I landed in the quality department in 2014. And there I maintained chest pain accreditation, which the hospital had already had for a while. So we are a certified chest pain center through the ACC or American College of Cardiology. So like I said, we've had that title for many years, but excited to have it. It's a great asset to our community. In 2019, we went down the journey of becoming a stroke center. So we became a primary stroke center through the Joint Commission and American Heart Association. And for the past couple months, I came into this new role and working on PCI, which is what we're going to talk about today.
This is so exciting. But I do want to take a moment. Let's go back and talk about our chest pain accreditation and what does that mean for our community? What services does that allow us to provide?
So being a chest pain center, we have policies and procedures in place to take care of our chest pain patients. There's many different types of chest pain. There's the chest pain emergencies. There's unstable anergia, STEMI. Our chest pain patients or cardiac patients know these terms. So what we have are things in place to handle these types of patients, whether they come through our emergency room or come in as inpatients.
And I know that comes with a lot of community education, staff education, all the policies and protocols in place to make sure that we give the best care possible to those patients that come into our ER.
Absolutely. Hands-only CPR is huge. We really promote that in our community. It's very important that you know and understand hands-only CPR. Our hospital-wide education is done every year on chest pain.
So starting a new program is not new for you. You mentioned your stroke journey. So let's tell them what that means for our community.
Okay, so being a primary stroke center, again, we have policies and procedures in place to take care of patients that come in via EMS or through our front doors with stroke-like symptoms. If you are having signs and symptoms of a stroke, we get you in really quickly. You have a head CT done, and then you are face-to-face with a neurologist via video at MUSC Charleston. And then we are able to make very quick decisions on if you get the clot-busting medicine for your stroke, or if you require medical management, or if you need to be transferred. So again, it all happens very quickly with stroke. We say time is brain. So again, very quickly to get to the hospital via EMS if you have stroke symptoms.
So the message here is call 911.
Absolutely.
If you're having any chest pain, symptoms, stroke-like symptoms. So let's take a moment and educate community members. What are the signs and symptoms of a heart attack, and when should they call 911?
So, heart attack symptoms can be tricky. You have your traditional chest pain. You can also have jaw pain. You can have pain in one or both arms. Women can have fatigue, dizziness, back pain.
Check. I have that on a weekly basis.
I know. So these symptoms can be sudden or not, or symptoms that just don't go away. But we encourage you to just come get checked out by our emergency room. Better be safe than sorry.
Safe than sorry. Yep.
Cardiovascular disease is so prevalent in our area. So, I mean, I can't count on my hand how many family members have cardiac issues, and we need to be paying attention to all of heart disease, all of cardiovascular. So that's your high blood pressure, high cholesterol, diabetes plays a part into it, a lot of comorbidities. Being in the South, we don't have the greatest track record.
Our lifestyle in the South,
absolutely.
Unfortunately.
Yes. So that's why it's so important to slow down. We as a society are so busy. We're working moms, there's always something to do. We need to slow down and listen to our bodies and go see a primary care doctor. And if they think you need to see a cardiologist, it's so important to go see that cardiologist and then start that pathway of testing and medicines. And I know it sounds scary, but it's in our area. It's here. It's in our families. There's
no denying it.
No.
We can't get past it.
No.
And we have 3 amazing cardiologists right here at Carolina Pines ready to take care of its community.
Absolutely.
All right, so we have some big news to share. January was a big month for us and a big advancement in the care that we provide here in Hartsville at Carolina Pines for our community. So share that big news.
Yes. So we are excited to partner with MUSC Florence cardiologist and offer elective PCI twice a week here at Carolina Pines, and we did our first PCI on January 8th.
Congratulations.
Thank you.
That's big news.
Yeah.
So I want to go back for a moment. Let's talk about what PCI is. What does that mean?
Yes. So PCI means Percutaneous Coronary Intervention.
Put that in layman's terms.
Layman's terms is we're placing a stent.
Okay.
So what that means is if you come with chest pain and do a cardiac cath, we are able to see if you have a narrowed or blocked artery. And now we can put a stent in to open up that blocked artery. While before this program was started, we would have to transfer you to do that. So traditionally, we've always done diagnostic casts here. Dr. Stellingworth has always done our diagnostic casts. But now, if we do see a problem, we're able to fix it right here without you having to go to another facility.
Right, because as you mentioned earlier, time is muscle, and that's a delay if we need to transfer out. And now we can do that right here where we can minimize that delay. Actually, you talked about the prevalence of cardiovascular disease in our area. So why does this matter? Why is this new program such a big deal?
So heart disease is the #1 killer in the United States. Our area.
It affects everyone.
Yeah.
There's someone in our family, there's someone in our community that it touches.
Yes. Genetics plays a huge part in heart disease. So in offering this now at Carolina Pines, you don't have to worry if you're going to the most appropriate place. We're able to take care of you here now, and it is needed in our area. And again, we're just so excited to be able to help our community, help our family members, our church members, and getting the care, the appropriate care that they need.
So you did mention it was elective. So talk to me, what does that mean? How does a patient get scheduled, or when would there be an opportunity for them to have a heart cath and may need a stent placed?
So the cardiac cath will be scheduled more than likely from your cardiologist. So Dr. Stellingworth, Dr. Bono, Dr. Bali can schedule these caths. Normally you've had an abnormal test prior to that, so an abnormal stress test, maybe even an abnormal diagnostic cath. And they think you may have a high probability of having a blockage. So we'll schedule them and then have Dr. Camus or one of his partners will be able to do the cath, and then again we're able to fix that blocked artery if we see it.
So if a patient has a stent placed, are they able to go home same day, or do they have to stay in the hospital?
Yes, so good question. If we are scheduled outpatient, then yes, you are more than likely to get to go home that same day after your stent is placed. You may have to stay overnight, but our goal is to get you home as quickly as possible. And with that being said, you'll have a lot of education going home. So you and your family member will get education on what type of stent you had, where it is, education on management, which isn't a lot of management with the stent. You're still able to do regular daily activities. We don't want you to go swim across the lake in the next 2 days, but just take it easy for a few weeks and then maintain normal activities. Medication. So medications is really important after you have a stent placed. You may be placed on an antiplatelet, and you must take that as prescribed by your cardiologist and then not stop taking that medicine unless your cardiologist tells you to. And you're able to follow up with your regular cardiologist. So you can go back to seeing Dr. Stillingworth, Bono, or Bali after one of the MUSC Florence cardiologists placed the stent.
So is that the only way that you can get scheduled for a heart cath? Or what about our patients that come in via EMS that are having chest pain? What would be the course of action for them?
Yeah, so again, if you are not having that active heart attack and are able to come here at Carolina Pines, and again, we rule out that you do not need to be transferred, you're able to stay, and then we can do the cath while you're here as an inpatient, and then still you may be able to go home that same day or the next day.
Very good. That is so exciting. And that's Carolina Pines leading heart care here in our community, right here at home for our family, our friends, our church members. It's an amazing achievement. So congratulations to you and your staff. So you mentioned multiple times MUSC Florence. So MUSC Florence and their partnership. They have been a good neighbor to us for many years and has partnered with us, like you said, advancing our stroke care here at Carolina Pines, and now with our PCI. So talk to me a little bit more about the partnership.
So back in the fall, our cath lab staff, who many of you know and love, went to MUSC Florence, and we actually trained with Dr. Camus and his partners and the cath lab over there, just to, we had to get new equipment. We had to get balloons and stents just to make sure we are well prepared to offer this safely and effectively to our community. So we did some training over there for a couple months, and now very confidently we're able to offer that here at Carolina Pines.
So where do you see this taking us? What's the next step?
Oh gosh. I would love to be able to offer this service 24/7.
Absolutely.
That is my goal for Carolina Pines and our community, and getting the care, the appropriate care that they need.
And Carolina Pines is committed to elevating the quality of care that we are providing to our community. And I can't wait to see what's next.
We're very excited. I can't wait either.
Thanks for listening to Pulse Check. If you enjoyed this episode, be sure to like, follow, subscribe, and share it with someone who might find it helpful. Your support helps this podcast reach more people in our community. Pulse Check is a production of Carolina Pines Regional Medical Center. Special thanks to our producers Hannah Cadell and Anna Tingen. Audio, video, and editing services by Seth and Grayson Johnson at Lockwood Studios. All content is for educational purposes only. We do not intend for the content to be a substitute for professional medical advice, counseling, diagnosis, or treatment. Our content doesn't engage visitors into a professional relationship. We'll see you on the next episode of Pulse Check.